The patient during examination opened his eyes in response to pain. Make no verbal response, but withdraw from pain. What is the GCF score? Eye opening, open in response to pain. So what is eye opening? It is response to pain. So the score is
2.
2.
2.
Okay. 2 plus no verbal response, but withdraw from pain.
No.
Verbal response only. No verbal response.
Withdraws from pain. That's 4.
How much? 4.
4.
Okay.
Verbal response, ma'am, 1, ma'am.
Verbal response is 1. Verbal response is not there. So 2
C
plus
is the answer,
1.
ma'am.
Yeah.
7.
So total
7.
it is. And what about motor response? Withdraws
Motor
in
response, withdrawal
5,
for
right?
pain, ma'am. Yes, ma'am. Localized pain.
Yeah, localized pain. So it is 4.
Yeah, that's good.
Okay, so 4 plus 2, 6 plus 1 is 7. So the answer is okay, very good. Next. A newborn Apgar score at 1 and 5 minutes is 5 and 10. That means at 1 minute it was 5 and now after 5 minutes it is 10. Half an hour later the baby become bluish in color with heart rate 140, 140. Your first action is A. Estimate the score again. Shower the baby with a warm water. Give oxygen immediately. Ignore the finding because it is normal. So remove wrong answer and then select the correct answer. Yes, what is the answer?
Estimate again.
Estimate the score again? No, because the skin become baby become blue in color.
Option C.
With a yes, so immediately start oxygen. C. Even hypothermia. What is hypothermia? Decreased number of decreased body temperature. Hypothermia will also causes bluish discoloration. Okay, in hypothermia also we can expect bluish discoloration. So, but you have to find out what is the basic reason for that. So for only those particular thing, what you can do is you can start oxygen. Why oxygen is required? Because initially the Apgar score was not normal. Okay, so that was the only reason. Okay, so why Apgar scoring is important? Why Apgar scoring is important? Apgar scoring usually necessary to identify the adoption or the basic. How does the baby adopt with the new situations? That is usually assessed by performing this. Okay. And in Apgar scoring, you have to assess A for activity and P is pulse, G grimace, that means reflexes. A is appearance. How does the skin look like? And respiration is R. Okay. So yes, next question number 86. Please go through. The primary critical observation for Apgar scoring is primary critical thing.
Heart rate.
Yes, exactly. It's heart rate or respiratory rate?
Heart rate. Yeah.
Yes.
That's vital for that.
So it is heart rate. Okay, fine. Next question. When performing a newborn assessment, the nurse should measure the vital signs in the following sequence.
Option D.
Answer is D,
Respiration,
ma'am. Respiration, pulse, temperature.
pulse temperature.
So it is
Respiration, pulse,
which one?
temperature.
Respiration, pulse, and
Pulse
temperature.
Temperature.
Okay. So the option is D, right?
Yes, ma'am.
Okay. Okay, fine. Next question. Within 3 minutes after birth, the normal heart rate of the infant may range between. So what is the normal range of heart rate after delivery? That means soon after delivery. Yes.
132 and 70 is incorrect.
132. So what is the normal fetal heart rate?
120 to 160.
120 to 160. So the answer would be most probably will be the same because the baby is just out. Fine. So the answer is
120 to 160.
okay. It's 120 to 160. Okay, next. Next question, the expected respiratory rate of a newborn within 3 minutes of birth may be as high as respiratory rate, maximum respiratory rate you have to select.
60.
Just, yeah, exactly. It is 60. So the maximum respiratory rate range is 60. Yeah. 40 to 60, the answer is. Next question. When performing nursing care for a newborn after birth, which intervention has the highest nursing priority? So these are the 4 things that usually we perform after delivery.
Answer is D, ma'am. Cover the neonate head with a cap.
Sure. Oh, so the answer for this question is D. Cover the neonatal head with a cap. And my next question is, what is the next step after this? Why covering is important?
To prevent
Because heat loss.
hypothermia.
Exactly. Hypothermia is the most leading cause for developing death. Okay, so the
Silent killer.
yes, it is considered as a silent killer and the most common reason for developing death rate. Fine. So covering the skin or covering the complete body is necessary to maintain proper skin temperature. Thermoregulation is not adequately fixed in case of newborn. Okay, fine. Have you heard about vitamin K injection that is usually administered in newborn?
Yes, ma'am.
Why?
Yes.
Where would you administer and why it is necessary?
In thigh.
You will administer
Vastus
thigh.
laterals.
You will administer on anterior lateral thigh.
Thigh.
That is called as vastus lateralis. Next, my question is why? Why vitamin K is important?
Prevent serious diseases.
To prevent bleeding.
Obviously, yes. Vitamin K is necessary to prevent bleeding. So why we need to administer vitamin K? Why we need to administer vitamin K for newborn?
Flora bacteria.
Yes. Vitamin K is type of vitamin. It's exactly fat soluble vitamin, but our body itself produce certain amount of vitamin K. Our body itself will produce certain amount of vitamin K. Okay. And vitamin K is produced by large intestinal flora bacteria. Okay. But in case of newborn,
How do
flora bacteria are not matured enough to produce adequate amount of vitamin K. That is the basic reason why you need to administer vitamin K for newborn. Okay. Flora bacteria are not matured enough to produce adequate amount of vitamin K. Okay, next question, please read. Which of the following instructions are appropriate for nurse to give the patient about the time of taking omeprazole?
Answer
C.
is C, ma'am.
C.
Taking the tablet 30 to 45
30 to
minutes before the meal.
Next, yes,
Omeprazole is
exactly.
antacid.
Yes, it's antacid and it should be given on empty stomach. Next question. Patient obtained a second-degree burn to his abdomen and his entire back. According to rule of 9, what is the percentage of burn of body surface area? So, see, based on rule of 9 classification, when head get affected, it is called as 9, and both hands are 9 each. Anterior chest 18, posterior chest 18, each thigh 18. That means each leg is 18. Fine. So here the patient on his abdomen and entire back.
That's
36%, ma'am.
36%.
36.
Abdomen 18 and back is
The
Yeah.
18.
entire
Sir,
back
ma'am.
is 18. Okay. Entire back, it's 18. Yes.
Front
And then
And the abdomen is 18.
abdomen 18.
abdomen is like, see, the total front portion is 18. Chest plus abdomen. Here only abdomen is affected. So you can
Okay,
take a
and
half.
only given 9. So that is 27.
Exactly. So the answer is 27.
27.
Clear? The entire anterior chest is 80. That means upper chest with abdomen. So here only abdomen is affected. So you can take 9. Can I give you one more example? You have to tell me the answer. A client who is admitted with a burn, right hand, right leg, right hand, right leg, and upper chest. Right hand, right leg, upper chest. Right hand, how much it will be? 9. Right leg, it is 18. So 9 plus 18.
27.
Plus and upper chest. So total chest is
30.
18. So half upper chest is 9. So
9.
yeah, so total it become
36.
36. Yes, exactly. So total it become 36. And the last question related with the same thing. A client who is admitted with a burn, please listen. Anterior right hand. Anterior right hand. Okay. Plus below knee, below right knee. Yes. Anterior right hand, below right knee. Anterior right hand will be calculated as, so total hand is 9. Anterior is only the front portion. So you can take
4.5.
half,
4.5.
4.5. 4.5
That's
plus,
9. 4.
yeah, below knee, total leg is 18. So below knee, only below knee it is 9. Okay, so 4.5 plus 9. So total become 9 plus 4 is 13 plus 13.5.
13.5.
Okay, exactly. Calculating body surface area is necessary in order to calculate the total fluid volume. Fine. So, for example, if you wanted to replace fluid for a patient with burns, the calculation is like this. There is a Baxter formula and Parkland formula. 4 ml into patient's body weight, it's kilogram, into body surface area affected. Okay. So it is BSA. Okay. So you will get one sum. And see, when you get a sum, so whatever the sum would be, and make half of the sum. So you need to take 2 half. And the first half need to be finished within 8 hours. And second half to be finished within 16 hours. That is how you need to calculate the fluid. Okay. Next question. In road traffic accident, a patient arrived in emergency department. On examination. Patient has increased heart rate and low BP and decreased the level of consciousness. You must think that the patient is developing dash.
Shock.
Yes.
Shock.
What kind of shock?
Hypovolemic.
Hypovolemic shock. Exactly. Second last question. Which of the following disease has no vaccination? Out of this, one of the disease is not having vaccination.
D. AIDS.
Yes, exactly. And next question. The type of burn in which all the dermis and epidermis destroyed and there is involved of underlying structure is called as. Dermis is affected and underlying tissues are also affected. So what are the layers of skin? Epidermis, dermis, subcutaneous tissues. Okay, epidermis, dermis, and subcutaneous tissue. So based on the layers affected in burns, it can be divided into first degree, second degree, third degree, and fourth degree. First degree, which means only the epidermis is affected, and second degree, it is the dermis is affected, and third degree, where subcutaneous tissues are affected. Fourth degree, bones are visible. So please select.
C1 full thickness or third degree one.
Exactly. So
third degree.
thickness and third degree burn. Okay, fine. So these are the common general questions which we have discussed. And in the next class, we will discuss question from maternity. So those who have not completed maternity class, please attend the class today itself and please make a note. And then tomorrow we will most probably will able to complete. Otherwise, we'll complete in the next day. But I feel like tomorrow will complete entire thing, and in the evening class, like night class, we'll be able to discuss the questions. Fine.
Okay, ma'am.
Okay,
And
ma'am.
one more thing I just wanted to say, that is from July month onwards, we have new timetable for the class, and I will send you the new timetable in the group. So please follow that. And the timetable is like this. Monday to Friday, classes are the same time. It's 10 to 12 p.m., 10 a.m. to 12 p.m. And alternative days, there will be night class at 8:30 to 10 p.m. And the same alternative days, you will be having an exam preparation sessions in the evening time. It will be at 3 p.m. to 5 p.m. Okay. So we have discussed, we have concluded this particular time period based on the request of the student. Every day, Monday to Friday, 10 to 12, topic discussion, and Monday, alternative days, Monday, Wednesday, and Friday, 3 to 5, question discussion, exam preparation, and revision classes. And alternative days again, Tuesday, Thursday, no, not Tuesday, Thursday. There'll be 3 days. Tuesday, not alternative days, Tuesday, Wednesday, and Thursday. No Friday. Tuesday, Wednesday, and Thursday will be having night class. Okay. So please try to attend all class and at least try to attend one single live session. And in afternoon sessions and revision class, whatever topics already we have completed, that will be discussed again as a revision. So whenever I send recorded classes, please try to complete the class very fast. And in the revision sessions, if you have any query or your doubts, okay, so please follow the timetable from July 1st onwards.